A new consultancy, a fresh approach is what I've given this presentation a title of. In doing so, thinking about this presentation, this is a quote that I found in David's material when I was going through some of his stuff. When I want to persuade a man, I spend 2/3 of the time thinking about what they want to hear and 1/3 about what I want to say. Hopefully, I've actually achieved that, will have achieved that this afternoon. The proof will be in the cooking, so to speak. But anyway, so moving on, why a new consultancy now? It's a difficult time, it's challenging times, very much so. But it's also very exciting times. But there's going to be challenges for us to meet. We've got to think about working smarter. We've got to provide more value and less volume. We've really got to make the research that we're doing count effectively and in budget. We all know now from the NHS there are far more things that we've got to measure. And because of that, we've got to be thinking about being more connected. We've got to use all of that available information to get real insight into patient behaviour and actually how we can support service delivery. Also, from those of us in the NHS, we know that things like the discovery interviews are very much in vogue, looking at the emotional and the behavioural. And we've got to focus more on that as well. I'm not saying that the days of questionnaire surveys and design are finished, but we've now got to think far more about the emotional and behavioural sides, getting really behind what the patients are feeling and thinking. But we've got to do this in a more systematic way. We've got to think, for example, about discovery interviews. We can't carry on the same way with discovery interviews as we are now, where we're presenting the qualitative data back to the team, and the team making some decision as to how they're going to do service improvement based on that. We've got to think systematically. Also, we need to adopt some emerging methodologies. And there are an awful lot of new methodologies out there, perhaps some of those which we think at the moment really don't fit into our schema, but they should do and will do eventually. So the social media, for example, using mobile phone technology, asking patients themselves at a particular point in time how they're feeling about this particular piece of part of treatment, or what are they thinking as they go through a particular part of the healthcare journey. So these are the challenges, but as I said, they're also exciting times. So DHP, what do we do? Well, we offer traditional and innovative approaches to help evaluate treatments and technologies and improve existing care and service and develop new services. That's our aim, and that's what we're out to achieve. And we do this across a wide client base: primary care, social enterprise, public health, pharma, medical devices, etc., around that, social enterprise and local authorities. So we've got a wide client base in which we want to aim at. What do we do? Well, what we want to do, and this is the important part, and this is something that Dave is going to talk about later on this afternoon, capitalise on existing data sets, getting value, real value out of the information that we've already got. As organisations, we've got a lot of information. A lot of that information is untapped. And so the way that we can capitalise on that, integrating that data, getting real insights from that data is extremely important. And this is something that we want to focus more on, helping organisations use existing information. That's also important from the point of view that existing information can tell us where there are weaknesses or where there's a need for more research. So it can prevent duplication, going out and doing some research when we've already got that information. And that's critical at this particular time. But there will be occasions where we will need to create new knowledge, go out there and collect that information, emotional and behavioural type knowledge. And also what is important, that we need to move from just creating knowledge. We've all been in that situation, haven't we, where we've got a report back from an agency or a consultancy. It's full of verbatim from qualitative, and there's a paragraph or 2 paragraphs at the back giving us a conclusion. Is that what we should be paying money for? We need information in which we can turn into action. So it's very important that we transform that knowledge into action. Patient-reported outcomes is also an important and integral part of DHP's work. I've got over 20-odd years of working on patient-reported outcomes, and some of you will be familiar with the diabetes health profile, which is being used in a number of studies and internationally used as well. I think we've got data on around 12,000 patients on that. And then also importantly, our training and skills development, which Charlie has initially developed and which is now part of the DHP's portfolio. But Charlie will be responsible for that training side of things, and Charlie will be talking about that this afternoon.